students, welcome to the academia. Today I will discuss some Q&A, that is questions answers regarding different competitive examination, regarding the research eligibility test, NET examination, SLET examination, and many more competitive exams. So our topic today will be blood cells. So the first question is what is the normal count of WBC? So the answer is the normal WBC count is 4 to 7,000 per mm cube. So it is 4 to 7,000 per mm cube. Next, question number 2. In which condition does the WBC count become low? So what will be the answer? In bone marrow depression and in some other diseases. So the main answer will be the bone marrow depression and in some other diseases. Okay, so this is the answer. Moving to question number 3, that what is the composition of WBC fluid? So the composition is, first of all, glacial acetic acid, then gentian violet, and distilled water. Okay. So what is the role of acetic acid? Actually, acetic acid causes the hemolysis of RBC, because when you collect the blood contains both RBC and WBC. So when you apply the WBC fluid, then it destroys the acetic acid present in that, destroys the RBCs. The gentian violet stains the nuclei of WBC, as the WBC having lobed nucleuses, some of them, and makes them easily identifiable. Okay. So next question, how much is the dilution for WBC count? So this is also very important question, that we know that when the blood is taken up to 0.5 and fluid up to 11 mark, dilution is 20 times. So the dilution is 20 times when the blood is taken up to 0.5 mark and it is filled up to 11 mark. Okay, this is usual. And if the blood is taken up to 1 mark, then the dilution becomes 10 times. So it depends. If the blood is taken up to 0.5, then the dilution is 20 times. So this is the usual way. Next question, why the dilution factor is lower in WBC count rather than the RBC count? As all of you know, the number of WBC in the first question, that it is only 4 to 10,000. So because of the less number of the WBC than RBC. So the answer is because of the less number of WBC than RBC. Okay. So the next question, are the WBCs destroyed before RBC count? As we know that before WBC count, RBCs are destroyed because otherwise they will interfere in the counting. But the WBCs are not destroyed, or it is not necessary because the WBCs are far less in number in comparison to RBC. So it is not necessary. Because due to the less number. Okay. Next, now name some conditions when WBC count is high in normal individuals. So basically the WBC is high in newborns, then during exercise, then the menstruation, and so these are the conditions. Next, when the WBC count increased, it is called leukocytosis. So leukocytosis means increased WBC count. Whereas what is leukopenia? Leukopenia means decreased WBC count. Okay, so this is about WBCs, some of the very important questions you should know regarding the WBC count, as well as about the conditions related with WBCs. Okay.